Hello, and welcome to the Exceptional Family Member Program's Early Intervention Overview. Over the next few minutes, we will define early intervention, identify developmental milestones, recognize the difference between an IFSP and an IEP, understand IDEA, or the Individuals with Disability Education Act, and learn about resources available to you. Let's begin. Early intervention is a system of services that helps infants and toddlers with developmental delays or disabilities. In North Carolina, early intervention refers to the system of services provided by many different agencies and programs for children birth to 5 and their families. This comprehensive interagency system is called Together We Grow. There are two parts of Together We Grow: infant through toddler programs for children birth to 3, preschool program for children ages 3 to 5. The North Carolina Interagency Coordinating Council is an advisory group to both programs. Developmental milestones are skills such as taking first steps, smiling for the first time, and waving bye-bye. Children reach milestones in how they play, learn, speak, behave, and move. They are categorized by social and emotional, language and communication, cognitive, which is learning, thinking, or problem solving, movement and physical development. For more detailed information on various developmental milestones, you can visit the Center for Disease Control and Prevention Learn the Signs Act Early website. Their web address is listed here. Please pause the video now if you wish to take note of the web address. Feel free to take this short quiz to determine how well you can spot developmental milestones. To take the quiz, please visit the website listed here. Take a few moments now to pause this video and take note of the web address provided. Children grow, develop, and learn at variable rates. A child's development can be measured by achievement of social, physical, and cognitive developmental milestones. A child with developmental delays is not developing like others at his or her age. Delays can be in one or more of the following areas: thinking and learning, moving, seeing, hearing, and health, understanding and using sounds, gestures and words, responding to and developing relationships, taking care of oneself when doing things like feeding or dressing. Early intervention services may also be available for a child with a diagnosed physical or mental condition that will probably cause developmental delay. For example, genetic disorder, vision problems, hearing loss, or autism. It is normal to have unsettling feelings and emotions towards a new diagnosis of developmental delay. The Camp Lejeune and New River community are fortunate to have a resource-rich environment to help service members and their dependents cope, learn, and grow within their situation. Here's what you can do. Register with the EFMP and connect with a family caseworker to help you navigate your new normal. Research and learn about your child's condition. Your local EFMP office has a lending library filled with books on various topics. Your EFMP family caseworker will also share information with you on your child's diagnosis and provide educational materials and resources. Expand your network of support to include families in similar situations. Seek out your state's Parent Training Information Center and discover which support services you qualify for. Talk to your family about the diagnosis and lean on them for support when needed. It is important to start early to increase the child's rate of learning and development. Guide parents on how best to support and advocate for their child, and ensuring long-term educational and developmental gains can be made. Additionally, early intervention helps decrease isolation and stress, empowers parents as they learn how to help their child, and improves outlook on life. Upon starting the early intervention process, you will be assigned a service coordinator who will plan, organize, and oversee the early intervention services needed for your family. Receive evaluations to determine specific developmental delays and to determine eligibility. Generate an individual family support plan, or an IFSP, to help strengthen and grow developmental skills. Have access to services that aid the strengthening and growth in developmental skills. Provide an easier transition into a school setting. A referral to early intervention services can be made by parents, physicians, or any other concerned person. Your service coordinator is assigned after the referral. They can help coordinate appointments for assessments and evaluations, help create your IFSP, and aids with transition out of early intervention. The evaluation process includes parent interviews, medical history screening, assessments by specialists in areas of particular concern, and it must be done within 45 days of the referral. After evaluations are concluded, you will take part in an eligibility meeting. This meeting is comprised of the parents and local professionals. You will all review the data and results from the evaluation process. The team will talk about whether or not your child meets criteria under the IDEA or state policy for early intervention services. Please pause this video and review this simple checklist. The list provides recommendations on items and people you should bring with you to the eligibility meeting. The Individuals with Disability Education Act, or IDEA, ensures services throughout the nation are available to children with disabilities. The goal of the law is to limit the effects of a child's disability or delay on his or her development. The services provided under IDEA are typically free. To learn more about IDEA, you can visit the web address listed here. Please take a moment to pause and take note of the address. Throughout the early intervention process, you are entitled to specific rights under the IDEA. Please pause this video to review some of your rights. Understand this is not an inclusive list of rights. For more information on your rights under the IDEA, please visit the website provided earlier in this video. Many parents are more familiar with an Individualized Education Program, or IEP, as opposed to an Individualized Family Support Plan, IFSP. For this reason, we have included a quick comparison for your review. Please pause this video to review the differences between an IFSP and an IEP. Also provided for you is a list of services available to you through the early intervention process. You can work with your family service coordinator to obtain the services needed as described on your IFSP. Please take a moment to pause the video and review the list provided. Military families face obstacles that many other Americans do not. Consistent relocation is a challenge when creating an environment conducive for consistent learning and growing. We recommend being extremely organized. Your EFMP family caseworker can help you create a special care organized record binder. When traveling, carry your early intervention documents. Contact your new early intervention program as soon as possible. Work closely with your EFMP family caseworker to coordinate transition to a new installation, and educate yourself on your child's needs to be the best advocate for their success. Provided for you here is a local resource in Jacksonville, North Carolina. Please pause the video to capture the web address provided. Another local support is the Children's Developmental Service Agency, or CDSA. They provide family support in addressing the special needs of infants or toddlers to enhance the development of the child. Please pause the video to take note of the information provided. For early intervention services on Camp Lejeune or New River, please contact the Educational and Developmental Intervention Services, or EDIS. Please pause the video to take note of the contact information provided. Thank you for your time. If you have any questions, please contact your local EFMP office using the contact information provided here.